Hi there. Thanks once again for joining me on the program, Your Doctor and COVID. I'm your host. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to discuss the COVID-19 pandemic, the way it's affecting us here in Guyana, and the way it's been affecting the world in general. If you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'll show you how I would recommend and how the WHO CDC recommends to wear the mask. Pick it up by the straps and you cover both the nose and the mouth. When taking it off, you also have to use the straps around the ears or the back of the head to take it off, and not the face of the mask, because that's where most of the germs and the viral particles from COVID-19 can actually settle. We're now in the latter part of May 2021, and COVID-19 continues to wreak havoc across the world. But most importantly, right at home in Guyana and our neighbors in Trinidad and Tobago as well as Suriname, we're experiencing a devastating surge in the number of positive cases, as well as the number of persons dying from COVID-19. In the case of our neighbors in Trinidad and Tobago, they have been in a lockdown scenario for more than a year, and one would think empirically that this is a very good strategy to prevent COVID-19. But what it does, it essentially reduces imported COVID-19 because of closure of ports, etc. But human behavior is often unpredictable, and so people are generally still congregating in private. They're still being less careful when interacting with persons that they know, even though guidelines have been set that you should continue to maintain social distancing, sanitizing, etc. But we can see the effect that all of these behaviors have had, that people sometimes have become tired, they become exhausted in following these guidelines. And as a result, we let our guards down. And weeks later, after exposure, there's now a massive surge, not just in Guyana, but in Trinidad, as well as in Suriname. So I want to encourage you, and as much as it's difficult and it's challenging to continue with the safety measures, it is still vitally important and critical that we continue to do these things. And as we continue the battle and the fight against COVID-19, one needs to examine the relationship between the testings, methodologies and types that are available, and how does that relate to reliability, accuracy, etc. So we have three types of tests that are available for COVID-19 infection: the antibody test, the antigen test, and the PCR test. Now let us examine a little bit the differences between this. So if we were to think that person is exposed on day 1, by the time 7 days after exposure, that's when, or 1 week, that's when the symptoms start to occur. The symptoms can occur from 1 week to 2 weeks after exposure, and they can last for, depending on how sick this person become, they can last from 2 weeks and even more. Now, from the time of exposure, your body then starts to develop some kind of resistance or immunity to this virus. And it does so by producing antibodies. The antibodies that are produced are only produced starting by after week 2. So by the time you start to get antibody positive, you're already too late into the disease process. So antibodies are useful to say that this person has had COVID in the past. It is not an indicator of current COVID-19 infection. So that's the antibody. It is an indicator of a previous or a past COVID-19 infection. For the presence of current COVID-19 infection, one has to do either of two tests, the antigen test or the PCR test. Now the antigen test is to pick up the protein particles of the virus, and the PCR is to pick up the genetic material of the virus. So if you think for a moment that the virus or the coronavirus is made up of two main components, the protein component and the genetic component. The protein component is like the perimeter. If you think of a ball, a cricket ball, it's like the surface, the perimeter of it. And the core or the center is where the genetic material lies. So at the beginning of the first week after exposure, that's when the genetic material starts to become detectable in the body. So, and that genetic material, it can be present in sufficient quantities by the end of the first week after exposure, and it can last for up to 4 weeks after exposure. And it's there in sufficient quantities generally for about 2 to 3 weeks so that it can be picked up by the PCR test. The antigen or the rapid antigen test, on the other hand, this is to look for the protein particles that actually surround the genetic material. And that can be present between the first to second week. And only for a short period, for a couple of days during that time, is it present in sufficient quantity to be detected by most of the available tests. And for this reason, many countries and many authorities still prefer to have a PCR test as the proper indicator of an infection. The PCR detects the genetic material of the virus, and the antigen detects the protein covering of the virus. So that's the main difference between those two. And to recap again, the antibody tests are just to show you that you would have had COVID-19 in the past. It doesn't tell you about active infections. The antigen test tells you about the protein particles of the virus, and that can be present for a short period. But the PCR is the more reliable one that detects the genetic material of the virus, and that can actually be present for a longer period in these patients. So the best time to actually do your PCR test is usually after day 5 to 8 of exposure. So in the first couple of days, especially if there are no symptoms, you may have a negative PCR test. But as you get more and more into the time of exposure to COVID-19, by the time you get to day 5 to day 8, that is when you have the highest yield from doing a PCR test. So if you are positive at that time, that is, a good indication that yes, there is an active infection. And so that is why most of the time, if you, for example, got exposed to somebody today who is COVID-19 positive, it is not likely that if you were to do your test tomorrow that you will pick up viral evidence. It is not likely that you will get a positive test tomorrow. But if you were to do this test 5 days or a week from your exposure, if you did actually get infected, that is when you expect to get a positive test. Which is why it is critically important that after exposure, especially to a known positive patient or someone with highly suggestive symptoms, after exposure, you would quarantine yourself, because during that period, until you are able to test negative, you may have the virus and be able to pass it on to someone else, even though you may test negative. So it's a very funny virus, it's a very tricky one to deal with, but understanding how it acts and how it relates to the time in which you get your test done is very important and very critical in helping us to fight this COVID-19 infection, not just as individuals, but as a population. If we know how to contain the spread and how to minimize the spread, then we could actually save more lives and reduce more admissions to hospital. So what does your test result actually mean? It's very critical to understand this. If you test positive for COVID-19, there are certain implications here. You must take steps to help prevent the spread of COVID-19. We have had horror stories of people who know that they are positive. They just did not act responsibly. They went out in public without face masks sometimes, continued to interact with people at work, continued to travel in public transportation, despite knowing that they would have tested positive for COVID-19. That's irresponsible and not acceptable behavior. If you know that you're COVID-19 positive, you need to isolate yourself and not expose others. You need to stay at home. Do not leave your home unless you are going to seek medical attention because you are sick. You need to get as much rest as possible and stay hydrated. Eat proper healthy foods once you have access to those things, and if you don't have, make sure that you can call friends or family who can drop off food and hydration, liquids, etc., so that you can be able to recover as best as possible. It is important to stay in touch with your healthcare provider, whether this is a doctor that you know or a family doctor, a nurse, a medics, a hospital. It is important to stay in contact with these people and monitor yourself for severe deterioration and complications from COVID-19. So throughout this pandemic, there are some questions that actually have been very common among people. And just for clarity's sake, I want to spend some time in trying to explain what is meant by a couple of things. So we often hear about direct contact, and what is meant by direct contact. Direct contact is if you have been within 3 feet of an infected person or someone with suspicious symptoms, and if you've been in that close proximity to them for more than 15 minutes. So it's being close to that person for a significant period of time. It's actually worse if that person was coughing and if you nor them were wearing masks. So the best thing to do is to maintain your social distancing and to wear your mask. When should you get tested? You should get tested if you have symptoms or if you have had direct contact and 5 to 7 days would have passed. Remember, that's the magic time period of getting tested. Sometime between day 5 to day 7, you should get tested. How long should you quarantine if positive? The answer is that you should stay quarantined and isolated from people for at least 14 days. The new metric for this is 10 plus 3. So that's 10 days plus an additional 3 days where you had no fever or needed no medicine to control fever. The other question is, do I quarantine if negative? Well, yes, if you had direct contact, as explained before, there could be a whole week that passed without you developing symptoms, but you are positive, and during that time, you could actually transmit to others around you. Do you need a negative test in order to go back to work? The answer is no. If you have been quarantined and isolated for 10+3 and you have no symptoms, you can then rejoin the workforce and continue to practice all of the safety measures as outlined by the relevant authorities. I hope this would have clarified some questions, and if you have any further questions or comments, please feel free to send us a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me, and I hope you have a pleasant rest of the day.